to be the nurse and the two pharmacists who will be visiting a patient in the home. Do we have the scenario?
These are your objectives, and this is the scenario that you're going to have for today.
So we're going to have 3 sessions here. This is the pre-session, which will be 20 minutes. Each session is 20 minutes long. Then we'll go and do the simulation for 20 minutes, and then we'll debrief for another 20 minutes. So you will have this time for the next 20 minutes or so to get to know one another, set some plans, set some expectations for what you're going to do. And we'll go from there. There's a couple points that we want to cover before you start discussing.
We're just going to go over the fiction contract for how this is going to work. So just so you know, there are medications in the room. They're Practimeds. They're not real medications. However, they're designed to look like real medications. I believe they're still in the sleeve, which normally you wouldn't have, but that's so that you can easily identify them. So what it says on that sleeve they are, that is what they are. Okay. There is an infant mannequin in the room. It's not high fidelity, so it's not going to cry, it's not going to breathe, it's not going to do things you would expect an infant to do, but it is alive. So you don't walk in and think like, oh, the baby's dead and start CPR. It's alive, it's just not high fidelity. If at any time in the simulation you need to call a physician, the pharmacy, or home health agency, anything like that, you can do so. We will answer and take on the role depending who you choose to call. So just say I'm making a phone call and go ahead and make the phone call. If there's anything you feel like you need to step out and there's anything you want to say or talk to each other about that you wouldn't want the patient to hear, you can just come out where we are so we can hear the conversation and the patient won't hear you. So you can feel free to do that as well. As Dr. Wells said, there's no pass-fail with this. The only way you could fail the simulation is if you break your contract and go and tell somebody about this. Then it's academic dishonesty. But other than that, this is meant to be formative, meaning that you're just going to be learning from this, learning to each other's roles, learning to collaborate with each other in a community setting. So the focus is really on the learning, and we're not going to be sitting there with a check sheet. There's no grade involved in this. So just participate. So for the next portion of this, what we'd like you to do is introduce yourselves to each other, your names, kind of talk about the nurse's role in the home and any experiences you have with it, the pharmacy role going into a home, if you have any experience with it, talk about your anxieties about the simulation or going into a real home as a pharmacist or nurse, and explain your roles to each other so that you kind of have an idea. And then you can review the case together and make your plan for what you're going to